تمام. أول شيء السلام عليكم جميعاً. حابة أعرف بنفسي. أنا اسمي منيرة الهدلق، طالبة في السنة الرابعة إن شاء الله في جامعة الملك سعود في كلية الطب. أول شيء حابة أشكر المجلس الطلابي والجروب Peer Assisted Learning for this amazing course اللي السنة الثالثة على التوالي. And I'm truly honored to give you guys this lecture. Hopefully it will be beneficial وتطلعون بفائدة إن شاء الله. يلا بسم الله نبدأ. Okay. So CNS infections هو موضوع very extensive, and no matter how hard we try, it's very difficult to cover it in just an hour. لأن عندكم أنواع من CNS infections. عندكم bacterial, viral, fungal, etc. But what I'm gonna give you in this lecture is just a quick introduction and an overview to the most important infections and the high yield stuff. خاصة إذا رايحين على سنة ثانية وال CNS block راح تاخذون هذه المحاضرة في أكثر من مادة. راح تاخذونها في الميكروبيولوجي، راح تاخذونها في الباثولوجي، راح تاخذونها في الفارماكولوجي. So having prior understanding or a prior idea is going to be helpful إن شاء الله. طيب. This is the objectives for a lecture. So first we're gonna identify the types of infections we have. Then we're gonna talk briefly about the routes of spread, how infections can reach your central nervous system. Then we're gonna go in details of, regarding bacterial infections and viral infections. And last but not least, we're just gonna take a quick overview on fungal and parasitic, just the most important ones. Okay, so types of CNS infections. When talking about CNS infections, there's generally two ways in which you can classify them. You can classify them according to the etiology or the causative organism, or you can classify them based on the anatomical structure they're affecting. So when we're talking about the etiology, مثلا نقدر نقول bacterial CNS infections, viral CNS infections, fungal CNS infections, and parasitic CNS infections. Based on the anatomical structure, as you guys know, the central nervous system is composed of your brain and your spinal cord. And you have your meninges, which are the three protective layers covering both your brain and your spinal cord. So infection can happen at any of these anatomical structures, whether it's the meninges, the brain parenchyma itself, or the spinal cord. For this lecture, we're gonna follow this هذه التقسيمة. ما أدري if you guys can see my cursor ولا لا، لكن نروح على حسب هذه التقسيمة based on etiology. So we're going to talk about bacterial, then viral, and then fungal, and then parasitic. طيب. Okay, كويس. شوفونا. طيب. الحين قلت إنه CNS is covered by 3 protective layers اللي هم المننجيز. طيب, such a protected organ, how can infection reach it? There are many ways or many routes that infection can spread to the CNS. First and most commonly is by hematogenous spread. فلما نتكلم بعد شوي عن causative organisms, one of the most important causative organisms is Streptococcus pneumonia. Streptococcus pneumonia is a well-known cause of respiratory tract infection. So it can start off as a respiratory tract infection, enter the bloodstream and reach your central nervous system, cross your blood-brain barrier, and enter your brain and your meninges and your spinal cord. So this is the most common route of spread. بعدها يجي direct implantation, which is quite self-explanatory, either due to trauma, okay, exposing your central nervous system to those pathogens, or when you have a congenital CNS malformation. I'm pretty sure you guys are going to have a lecture on congenital CNS malformations. منها spina bifida, where you have a defect, وأحيانا in cases of myelomeningocele, you have your meninges protruding through that defect. So this is obviously going to be prone to infection. ثالث route اللي هو local extension. فيكون عندك infection, an established infection, but it's in a nearby organ. مثلا عندكم sinusitis, عندكم an infected tooth, otitis media. كل هذولي are adjacent structures to your central nervous system, and infection can spread directly. Last but not least, we have through the peripheral nervous system, and this happens with certain viruses like rabies and herpes. We're going to talk about them later on in this lecture. Okay, so we're going to start with bacterial infections because I think they're the most important ones. Okay, so how can bacteria manifest in the central nervous system? Bacterial infections manifest in many ways in the central nervous system, either as acute pyogenic meningitis, or as chronic meningitis, or as cerebritis, or a brain abscess. Today, we're only going to talk about the first two for the sake of time, and they're also the most important two, the acute pyogenic meningitis and chronic meningitis. So let us first start with the acute pyogenic meningitis. ناخذ الاسم حبة حبة. Acute meaning that it's sudden in onset. We're talking days, okay? Pyogenic means pus forming. We have suppuration, we have pus. Meningitis, as I said, is inflammation of the meninges, which are the three protective layers covering covering your central nervous system. So if you were to take a look here, you have your skin, then your skull, and then your three protective layers اللي هم dura mater from outside to inside, dura mater, arachnoid mater, and the pia mater. When we talk about meningitis, we're generally referring to the inner two, الارachnoid والpia. The dura mater is usually spared, and collectively the arachnoid and the pia mater are referred to as the leptomeninges. So if you hear the term leptomeningitis, it basically means meningitis, نفس الشيء. Also, there is an important space between the arachnoid and the pia mater, اللي هو subarachnoid space, where your cerebrospinal fluid circulates. So when we say pyogenic meningitis, we mean inflammation of the meninges affecting the pia mater, the arachnoid mater, and the subarachnoid space with separation of the cerebrospinal fluid. And as I said, it's acute in onset. This is a gross picture of acute pyogenic meningitis, and the white stuff that you guys see is the purulent exudate. If you were to take one thing out of this lecture, لو بتطلعون بس بمعلومة واحدة من هذه المحاضرة, I would say it's this slide. It's very, very important. The causative organism differs according to the age group. كل عمر محدد لهم organism معين. But this is important when we come to the treatment and when we come to empiric treatment and what you need to cover with antibiotics. طيب أول شيء عندنا newborns, يعني من وقت الولادة إلى تقريبا شهرين. هذولي the most common organism, واحفظوه زي اسمكم اللي هو الجروب B Streptococcus. بعده يجي الإيكولاي. Listeria is less common, but the most important two are the group B Streptococcus and the E. coli. حلو؟ بعدها نجي older children, يعني infants, children, and even adolescents. The most common organisms are these two, Streptococcus pneumonia and Neisseria meningitidis. بعدها نجي Haemophilus, not so much. It's nice to know, but it's not as important as these two. For adults, it's similar. It's Streptococcus pneumonia and Neisseria meningitidis. طيب ليش تختلف الأورجانيزمز؟ ليش النيوبورنز الأورجانيزمز حقتهم غير حقة الأدلتس؟ أحد عنده فكرة؟ If you guys know, write it in the chat. Anyone? Okay, never mind. ليش immune system is underdeveloped? Okay, that could be a reason, yes, but mainly it's due to the route of spread. Route of spread is different. يعني لو تلاحظون بالadults زي ما قلنا قبل, Streptococcus pneumonia is a important causative agent for respiratory tract infections, and once they have a respiratory tract infection, it spreads through the blood to their meninges. Whereas in newborns, when we're going to talk about each bacteria لحالها, الجروب B Streptococcus والE. coli هذول usually residents of the GI, residents of the vagina. So when the baby is passing through the birth canal, there's risk of colonization of the baby. And also if there is rupture of the amniotic, the amniotic fluid, through the amniotic fluid. So that's one cause. واضح؟ Okay. طيب. Actually برجع شوية. طيب نجي للsymptoms حقت المننجايتس. Anyone has any idea what are the most important symptoms of meningitis? Neck pain, headache, fever. خلاص هذا أهم شيء. الneck pain والheadache والfever. Yeah, neck pain or neck stiffness, exactly. Okay, so you have your classic triad of a sudden high-grade fever, or high-grade fever in cases of bacterial meningitis. لما نتكلم عن viral meningitis, it's going to be ما راح تكون مرة high-grade fever. بعدها severe headache والneck stiffness أو knuckle rigidity. هذول الثلاثة هم الكلاسيك triad حق acute meningitis. Other symptoms may be photophobia, the neck and leg thing. The neck and leg thing, we're going to talk about them besides examination. Other symptoms, photophobia, which is sensitivity to bright light. There may also be nausea and or vomiting, skin rash or petechiae. هذه extremely important. شوفوها اللي في الصورة اللي أنا حطتها على جنب. هذول تجي في الcases of Neisseria. دائما يحبونها في الكيس سيناريوز. والله واحد راح الحج ورجع وفيفر وهدك ونك stiffness. On examination you found this. What is the most likely organism? Neisseria. هذه راح نعرف ليش تسبب this kind of rash or petechiae لما نتكلم عن pathogenesis of Neisseria. لكن it's a very important finding. Others include altered level of consciousness, irritability, seizures in severe cases. Hello? One thing you have to keep in mind is that in infants, presentation can differ. الانفنت ما راح يجي يقول والله أنا مصدع ولا my neck is stiff. They can't speak, they can't express themselves. So they usually just present with atypical vague symptoms such as inactivity, irritability, vomiting, poor feeding. يعني يكون you know there's something wrong with the baby, but you can't exactly pinpoint what's wrong. So this is an important point to keep in mind, that infants don't always present the same as adults, even when it's the same exact disease. طيب نجي الآن للساينز. طبعاً جاكم واحد you took history, you took all the symptoms. Now it's time for your physical examination. Obviously, you're going to take the vital signs. راح تتأكدون من الفيفر. You're going to check for neck stiffness, etc. لكن في these two important signs that are not very sensitive, but they're quite specific for acute meningitis. الأولى اللي هي الكيرنيغ's sign. الكيرنيغ's sign يكون ال patient lying كذا supine على ظهره, and you bend their hip to 90 degrees, bend their knee to 90 degrees, and then you try and straighten their leg. Inability to straighten the leg is considered as a positive Kernick's test. Okay, واضح? Usually بيكون في extreme stiffness, you can't straighten the leg. It may also be accompanied by back pain. Okay, so that's the first one, Kernick's sign. How I remember it, K for knee, but you don't even pronounce the K in knee, so that's useless. أتمنى أنكم يعني تذكرون أحسن مني. Anyways, نجي للثانية اللي هي ال Brzezinski sign. Also, the patient is lying supine on their back. What you do is you try and flex their neck. The flexion of the neck will cause involuntary flexion of the knees and the hip. So once that happens, you have a positive Brzezinski sign. واضحة two signs؟ واضحة؟ Okay. طيب الحين نجي نتكلم عن each organism لحالة. Okay, the most important organisms. نبدأ بالنيسيريا. النيسيريا أول شيء قبل ما نبدأ, it's important for each bacteria إنكم تعرفون المورفولوجي. يعني الجرام نيجاتيف ديبلوكوكاي, جرام بوزيتيف ديبلوكوكاي, جرام نيجاتيف باسيلاي، هذه الأشياء، لأن جدا وارد إنه يجيكم مثلا سؤال في الاختبار يعطيك سيناريو بعدين يقول لك والله سوينا on gram stain there was we found gram negative diplococci, what is the organism. فمهم إنكم تعرفون المورفولوجي، لأن ممكن يكون هذا بحد ذاته سؤال، يعطيك المورفولوجي ويقول لك يلا وش الأورجانيزم. it's important to remember. طيب نبدأ بالنيسيريا مننجيتيدس اللي هو gram negative diplococci. You can remember it N for negative, Neisseria for negative. How is Neisseria transmitted? It's transmitted by inhalation and close contact. Okay? ولو تتذكرون الجدول اللي قلنا Neisseria mainly affects the children والadolescents والolder adults. It doesn't affect neonates. But it's most common in children under the age of 6. Okay? It has many serotypes. أهمها في A و B و C و Y I guess, but أهمها serotype A. السيروتايب A ليش مهم؟ لأن it has an epidemic potential باللي يسمونه meningitis belt. Okay? So it can cause epidemics. The others cause epidemics but in areas of close contact such as مثلا موسم الحج. طيب pathogenesis of النيسيريا تقريبا في ناس تكون النيسيريا normal flora in their nasopharynx. So some people النيسيريا is a normal flora in their nasopharynx. Others they acquire it, as we said, by inhalation and close contacts. طيب once the bacteria colonizes the nasopharynx, it has كذا زي اليدين اسمها pili, it uses them to attach to the nasopharynx and invade. Okay, it invades the blood vessels leading to septicemia. توصل your central nervous system, releases a endotoxin اللي هو LPS endotoxin, and this spreads to your meninges. This endotoxin causes widespread endothelial damage and leads to activation of the coagulation cascade. راح يكون عندكم platelet aggregation, thrombosis, وبالنهاية راح يكون في severe bleeding. ولو تتذكرون قلنا هذه الpetechiae, which is basically bleeding under the skin. الحين عرفنا ليش يصير هذه مع النيسيريا، لأن this is the pathogenesis of Neisseria. It causes bleeding leading to skin rash and adrenal hemorrhage. لكن أهم شيء تعرفون السكين راش. تمام؟ for Neisseria we have it has 3 virulence factors. أولهم الكبسول هذا البوليساكرايد polymer capsule. This resists phagocytosis by the host's immune system. بعدها عندنا البيلاي which help to attach the bacteria to the nasopharynx and invade. And last but not least, we have the endotoxin which spreads to the meninges and causes all of this. Unfortunately, 11% of recovered patients will suffer from permanent hearing loss and mental retardation. طيب نجي للسكند organism اللي هو Cryptococcus pneumonia اللي قلنا نفس الشيء, doesn't affect neonates, mainly adolescents and adults. Again, it's a gram-positive diplococci. Neisseria was gram-negative diplococci. So here N for negative and here P for positive. It also has a capsule which helps it resist phagocytosis, اللي هو polysaccharide polymer capsule, and it also has its own specific toxin, اللي هو pneumolysine toxin. Recovered cases of Streptococcus pneumonia meningitis develop sustained learning disabilities. نجي لآخر نوع اللي هو Haemophilus influenza, is a gram-negative coccobacilli, so it's polymorphic in shape. And as the name implies, Haemophilus, so it loves blood, it needs blood for growth, it needs factor 5 and needs factor 10. Okay? It has many serotypes زي Neisseria, لكن أهمها serotype B, and you can remember it B for bad. It's the one that causes severe meningitis, or it causes acute life-threatening invasive infections. But fortunately, less and less cases are seen now due to the presence of a vaccine. تمام؟ طيب نجي الآن نتكلم عن الانفنت بكتيرياز. أولها الجروب B Streptococcus. It's a gram-positive cocci in chains. زي ما قلت أول, it's a resident bacteria in the GIT and the vagina. And it's the #1 cause of neonatal meningitis. This is very important. The #1 cause of neonatal meningitis is group B Streptococcus. طيب, how does it transmit to the baby? It gains access to amniotic fluid during delivery, or it may colonize the newborn when the newborn passes through the birth canal. طيب, إيش الريسك factors? ليش some babies acquire it and some babies don't? Risk factors include premature rupture of the membrane, or general prematurity of the baby, or if the infant has a low innate immunity. دايما فكروا فيها, أي شيء يسبب تعسر في الحمل, مثلا prolonged labor, there's going to be an increased chance of infection with group B Streptococcus. بعدها يجي ال E. coli. It's the second most common cause of neonatal meningitis. It's a gram-negative bacilli, نفس route of transmission حق ال group B Streptococcus. Yeah, that's all you really have to know. Last but not least, you have Listeria Monocytogenes. Listeria Monocytogenes are gram-positive rods, and honestly, they're not that important. يعني مو مرة مهم تعرفونها. Just know that it's a cause of meningitis in 3 groups. يا أما elderly مرة فوق 60 سنة, يا أما newborns, أو anyone immunocompromised. So it causes meningitis in the extremities of age or someone who's immunocompromised. A route of transmission generally has 2 routes of transmission. It spreads to the fetus following hematogenous spread in the mother, or from the birth canal, نفس الشيء. It can spread through animals, including those associated with certain foods, مثلا cheese والmeat وهذولي. And an interesting fact about it is that it resists refrigeration also. طيب, نجي للdiagnosis. Diagnosis مرة مهم حق meningitis. طبعا you're gonna do your usual blood work, CBC, etc. Then you want to do, or the definitive diagnosis for meningitis is a lumbar puncture. But before you do a lumbar puncture, you must rule out increased intracranial pressure. Okay, and we do that by performing a CT scan of the head. طيب, ليش خطر إنه يكون عند البيشنت increased intracranial pressure وحنا نسوي lumbar puncture? It's an absolute contraindication to perform a lumbar puncture in cases of increased intracranial pressure. لأن if the patient has an increased intracranial pressure, this will increase the risk of herniation of the brain when you perform a lumbar puncture. Think about it, if you have a high pressure in your cranium and you insert a needle here and you withdraw fluid, you're creating an area of low pressure. Obviously this high pressure is going to try and escape. Okay, تبغى تروح من area of high pressure to area of low pressure. Yeah, you need to prevent this escape, exactly. And this will lead to brain herniation through the foramen magnum. This can lead to immediate death because you're compressing very vital structures such as the respiratory center and the brain stem وغيرها. تمام, واضح؟ طيب. Okay, so once you do your lumbar puncture, how we reduce the intracranial pressure. There are certain ways you can reduce the intracranial pressure by performing shunts. You try to shunt the excess fluid that is causing the increased pressure. Sometimes when you do a CT, you can find a mass lesion that is causing this increased pressure, an abscess. You can drain it depending on the cause of the increased intracranial pressure. Yeah, or mannitol, yeah. بس أهم شيء إنه you must rule out increased intracranial pressure. So the contraindications of a lumbar puncture is increased intracranial pressure or obvious infection or cellulitis at the site of needle insertion. This is also a contraindication. Oops, sorry. Okay, so once you do your lumbar puncture, you insert your needle to the subarachnoid space to try and collect some cerebrospinal fluid. Usually it's done between L3 and L4. Okay, so the first thing you want to see is the appearance of the fluid. The normal appearance of cerebrospinal fluid is clear, زي الموية. تمام? If it's turbid, if it's showing any pus, then this is highly suggestive of bacterial infection. Then you want to look at the cell count with differential. Differential is very important. You want to see the most predominant cell type لأنه تفرق الcell types بالبكتيريال من الفيرال بالtuberculous نتكلم عنها بعد شوي. You want to check the glucose levels, the protein levels. You want to do gram stain and culture. There are certain additional tests you can do. If you're suspecting a tuberculosis, you can do an acid-fast bacilli smear, PCR and culture for tuberculosis. If you're suspecting brucella, you can do brucella serology and PCR. هذول كلهم بنتكلم بس هذول TB والبروسيلا are usually causes of chronic meningitis مو acute. طيب. So the current slide اللي قلت هذه أهم شيء تطلعون فيها حقة organisms. Add this one to it. The cerebrospinal fluid analysis is very, very important. موجودة عندكم هي سلايدزكم يعني الصدقية فيها numbers كثير وvalues وما أدري إيش لكن أتذكر كل الدكاترة قالوا ما يحتاج تعرفون certain values أهم شيء you know the concept and you understand it. تمام؟ So I tried to remove the values as much as I can and just put the general idea so it's easier for you guys. Okay, so CSF analysis can guide us عشان نعرف what is the cause of an infection. You have, in cases of acute bacteria, a cell count, a WBC count, راح يكون above 1000, definitely. تمام? Keep in mind that normal WBCs in normal CSF ما يتعدى 5. So more than 1000, فأي شيء لما تشوفون آلاف this is bacterial and it's mostly neutrophils. The glucose is going to be extremely low in bacterial meningitis والبروتين راح يكون high. تمام؟ أما في الكرونيك بكتيريا راح تكون ال WBCs في المئات عادة من 100 إلى 500 والpredominant cell type is lymphocytes. الجلوكوز راح يكون low والبروتين high. الaseptic أو الviral meningitis ال WBCs generally never exceed 1000 دائما أقل من 1000 دائما أقل من 1000 usually you'll see it in the hundreds range. والجلوكوز راح يكون normal والبروتين راح يكون normal with moderate elevation. طيب إيش هذا؟ What is the normal content of CSF protein and glucose? Okay, so the normal content of protein is usually from 15 to 50 milligrams, and glucose is usually 45 to 100. Okay. زي ما قلت, you don't at this level you don't really need to know the normal values or how elevated they will be. عادة a normal value will be given in the question, but just for your general knowledge. Okay. طيب نجي الآن لل CSF analysis واضح؟ مرة مهم ترى. Any questions? تمام. Okay, now we move on to the treatment. One thing you have to keep in mind is that acute pyogenic meningitis is extremely fatal. If someone presents with the classic symptoms and you suspect meningitis, you need to start treatment immediately. You start empiric antibiotic therapy immediately after you perform an LP. And sometimes even if you feel like the LP is going to be delayed, you start empiric antibiotic therapy if you highly suspect meningitis. In children and adults, it's important to remember these drug combinations. In children and adults, obviously you're going to give intravenous. You give intravenous ceftriaxone, which generally covers the gram-negative bacteria, and you add vancomycin, generally covers the gram-positive bacteria. You may add ampicillin if the patient is at risk for listeria. So if they're at the extremities of age, مثلا neonate ولا a very old person, or the patient is immunocompromised, then you may add ampicillin. For neonates, a combination of ampicillin, gentamicin, and cefotaxime. طيب لو تتذكرون في النيسيريا قلنا the route of transmission was inhalation and close contact. Once we confirmed that this patient has meningococcal meningitis, it's important to give chemoprophylaxis to all the household contacts اللي هو تعامل معهم. So usually rifampin is given, or ciprofloxacin, or ceftriaxone. One of them is given for all household contacts. So again, the treatment for acute pyogenic meningitis and the drugs are extremely important to remember. طيب نجي للchronic meningitis. Chronic meningitis, as I said before, it's mainly caused by tuberculosis or brucellosis. Tuberculosis, يعني you guys I think أخذتوا tuberculosis أكثر من مرة وطلعوها من خشمكم, لكن yeah, it can also cause meningitis. It may or may not be preceded by something called the tuberculoma, اللي هي هذه اللي في الصورة اللي عليها الأرو. Tuberculoma is basically a well-circumscribed intraparenchymal mass. Sometimes it ruptures into the subarachnoid space, leading to tuberculous meningitis. So tuberculous meningitis may be preceded by tuberculoma or sometimes just لحالها. Also, a tuberculoma sometimes can be mistaken for a tumor. It can mimic a tumor. طيب, brucellosis is important to remember the risk factor for it. It affects people who are in contact with domestic animals or those people who consume raw milk and milk products. Brucellosis is quite common هنا عندنا في السعودية, always you should have it in mind and always suspect it. An important feature of brucellosis is that it presents with fever that is intermittent in nature, and it also presents with night sweats. Sometimes when we have partially treated acute meningitis, wasn't treated very well, it can progress to chronic meningitis. طيب, خلصنا الحين من ال most important bacterial infections. Does anyone have any questions before we go on to the viral infection? No questions. طيب, now we move on to the viral infections. طيب, the viral infections, how do viruses manifest in the nervous system? They can manifest as aseptic meningitis, or poliomyelitis, or encephalitis. Aren't brucellosis symptoms similar to TB? Yes, they are similar. You generally need examination, lab values to tell the difference, and also the history can help you. And usually tuberculosis, it may be preceded by a pulmonary tuberculosis infection. So that history plays an important role here in differentiation between tuberculosis and brucellosis. طيب, viral infections, again, aseptic meningitis, poliomyelitis, and encephalitis. Aseptic meningitis or viral meningitis is mainly caused by enteroviruses, mainly the poliovirus. How does poliovirus spread? By the fecal oral route, so by contaminated water or contaminated food. And then they enter the bloodstream or the CNS, either by the bloodstream or by ascending through the peripheral nerves. And they usually cause destruction of the motor neurons of the anterior horn cells. Clinical features of viral meningitis, generally the same as bacterial meningitis, but less severe. it may even be difficult to distinguish it clinically from acute bacterial meningitis. Sometimes if someone presents with meningitis symptoms and you can't really tell if this is bacterial or viral, just in case you treat it as if it's a bacterial, because bacterial is very life-threatening and can be really fatal, and you don't want to miss it. Treatment of a viral meningitis is just supportive therapy. ما في antiviral that can treat viral meningitis. The disease is self-limited, has a much better prognosis than bacterial meningitis. So it's not as serious as bacterial meningitis. طيب نجي للpoliomyelitis. Poliomyelitis is used to identify the disease caused by poliovirus. So the poliovirus زي ما قلنا can cause, it has two patterns, okay? يا أما يسبب لك a minor illness, does not usually involve the CNS, ما يهمنا الآن. We're talking about the major illness that involves the CNS. This major illness that involves the CNS can be further divided into paralytic or non-paralytic. So as the name implies, one causing paralysis and one not causing paralysis. Non-paralytic poliomyelitis اللي قبل شوي تكلمنا عنه هذا aseptic meningitis يسبب لك بس meningitis, no paralysis, no nothing. Self-limited. أما paralytic poliomyelitis اللي هو flaccid paralysis اللي هو شلل للأطفال, it causes asymmetric muscle weakness. It affects legs more than the arms. It leads to absent deep tendon reflexes on examination. المسلز راح تكون flaccid, كذا رخوة وatrophic. But one important thing to keep in mind that they have a preserved sensation. A sensation is completely normal. They're just losing the movement. Once they're losing their movement, ما في reflexes, ما في, the muscles become atrophied and flaccid. لأن زي ما قلنا هنا, it causes destruction of the motor neurons of the anterior horn cells. This doesn't affect the cells اللي هنا اللي مسؤولة عن sensation. It affects the anterior horn cells which are responsible for motor function. طيب, diagnosis, how they diagnose poliomyelitis, usually they isolate the virus and culture it. It's the most sensitive method to diagnose a poliovirus infection. Usually the specimen taken is a stool sample. Sometimes they even take a pharyngeal swab or blood or CSF, but most commonly a stool sample. The best specimen is the stool. The best way to diagnose is virus isolation and culture. Very important. طيب, هنا هذه صورة بس توريكم ال distribution of the muscle weakness. Treatment, unfortunately, there's no treatment available, لكن it's entirely preventable by vaccination. طيب, تكلمنا عن المننجايتس, تكلمنا عن البوليومايلايتس, الحين نجي للانسفالايتس or inflammation of the brain itself, مو المننجيز. طيب, الفيرال encephalitis is mostly caused by HSV1, herpes simplex virus 1, also called herpes simplex encephalitis. حلو؟ طيب, عندنا 1 وعندنا 2. 2 usually causes more genital infections, but 1 is the one that we're going to talk about today. طيب, how does the virus enter the body? It enters through any abrasion, cutaneous or mucosal surfaces, to infect sensory or autonomic nerve endings. تمام? And then, as we said, it ascends through the peripheral nerves to go and remain dormant in a ganglion. The ganglion is a collection of cell bodies. In cases of herpes simplex virus 1, it replicates and stays dormant in the trigeminal ganglia. Okay, and we call it the latent phase. تجلس للأبد until it reactivates, and this reactivation in the trigeminal ganglion will result in spread to the brain, especially the temporal lobe. And it spreads, as we said, through the meningeal branches of cranial nerve number 5, اللي هو trigeminal. So its route of transmission is first يدخل through cutaneous or mucosal surfaces. بعدها through the peripheral nerves, it goes and lays dormant in the trigeminal ganglia. And then it reactivates and through the nerves again ascends to your central nervous system. and most commonly affects your temporal lobe. Clear pathogenesis? طيب. Reactivation إذا كان immunocompromised. Yeah, generally, yeah, in any state of when you're immunocompromised, or you're more prone to have reactivation. Okay, الherpes simplex encephalitis الكلينيكال features حقتها غير عن المننجايتس، تختلف شوية. هنا there's more of seizures, there's more of altered mental status, there's more of focal neurological deficits, because it's affecting the brain tissue itself, the brain parenchyma. They also present with fever, headache, or vomiting. Like most commonly, they present with focal neurological deficits, loss of consciousness, altered mental status, إلى آخره. Type diagnosis, MRI to reveal the temporal lesion is the most important. As you can see here in the picture, the MRI, you can see that the lesion in the temporal lobe. Or you can do a PCR to detect the DNA of the virus. Treatment, it is the only treatable viral CNS infection. تذكرون poliomyelitis ما كان له treatment. الviral meningitis ما كان له treatment. أما هنا عندنا treatment اللي هو acyclovir. طيب. Now we move on to the fungal infections. The fungal infections are not really that common. Not very important. No, I'm not going to say not very important, not as important as bacterial and viral infections, but I only mentioned the most common one, and yeah, it's nice to know about. The fungal infections of the CNS, generally, they're not common in normal healthy individuals. يعني ما في شخص healthy يجي له fungal infection of the CNS. لازم يكون في state of immunocompromise. Risk factors كثيرة، لكن أهمها هذول الثلاثة. ال HIV وال AIDS, they're at extremely higher risk than the rest of the population to develop fungal infections of the CNS. Anyone receiving solid organ transplantation, and patients who have diabetes. في a lot of fungal agents وأسماء كثيرة وعجيبة وغريبة، لكن أهمها generally fungi are classified into yeast or mold. فاليست the most important one is الكانديدا والكريبتوكوكس. في اللكتشر هذه راح نتكلم عن الكريبتوكوكس لأن it's the most common cause of fungal meningitis. المولد عندك الأسبرجيلس والزيغومايسيتس، بس ما راح نتكلم عن المولد. We're only going to talk about Cryptococcus. I think you guys are going to have a full lecture بالCNS block عن كل الفنجاي، لكن the most important one is الكريبتوكوكس. طيب الكريبتوكوكال meningitis هذه الجملة مرة مهمة. AIDS is the leading predisposing factor for cryptococcal meningitis. يعني لما تشوفون case of cryptococcal meningitis or a patient, AIDS patient, and they tell you what's the most likely organism, it's Cryptococcus. Okay? الاتيولوجي اللي هو الكريبتوكوكس neoformans, it's a capsulated yeast cell naturally found in pigeon habitats. A route of transmission is by inhalation. How we diagnose it, we do serology to detect the antigen of the capsule. Sometimes we do direct microscopy of the cerebrospinal fluid with a special stain اللي هي الإنديا إنك stain. هذه المعلومة مرة يحبونها for some reason. الإنديا إنك stain is very important because it allows you to see the capsule of the Cryptococcus, and it's diagnostic. Here's a picture in India ink preparation that shows the Cryptococcus neoformans in the CSF. هذا the white thing is the capsule. Treatment is amphotericin B or flucitazine, however you pronounce it. Okay, واضح الفنجاي؟ طيب. Okay, last but not least, parasitic infection. Parasitic infections, I'm only going to talk about one, the most common one, اللي هي Toxoplasmosis. Toxoplasmosis is caused by the organism Toxoplasma gonadii. It transmits through cats. Cats are the essential definitive host. تمام؟ يا أما transmits either by raw meat or direct contact with cat feces. The types of diseases it can cause, if we have a pregnant lady and she gets toxoplasmosis, she's going to manifest with flu-like illness. But the problem is that the fetus may be infected. And if the infection crosses the placenta early, it causes very severe congenital infections, like intracerebral calcifications, chorioretinitis, hydrocephalus, microcephaly, convulsions. So it can be extremely fatal for the infant. Another high yield information that you need to know about is that AIDS patients are at an increased risk of acquiring toxoplasmosis. And it's a leading cause of focal CNS disease in AIDS patients. وهذا appearance is a classic appearance of toxoplasmosis in a patient with AIDS. يوريك ring enhancement on a brain scan. تمام? So this comes a lot in questions. You did an MRI, you did a CT, you saw the classic ring enhancing. Patient has AIDS. What's the diagnosis? Toxoplasmosis. How is it diagnosed? By serology, by detecting antibodies. Treatment is by combination of pyrimethamine and sulfadiazine. طيب. الحين okay, focal CNS, what does focal CNS disease mean? Okay, it causes disease to a certain area, مثلا temporal lobe, and the symptoms تكون reflecting the area of that disease. يعني meningitis is a widespread disease. أما لما يكون focal كذا معناتها it affects a certain lobe, a certain area. استوعبتي؟ Okay, good. نجي الحين للكيس سيناريوز. جبت كم كيس سيناريو to kind of review what we took. بسأل wait. إيه بسألكم إياها و you guys can answer in the chat and then we can discuss it together. تمام؟ يلا. Okay. Case number 1. A 20-year-old man came to the clinic complaining of neck stiffness and headache since 3 days. After taking history, it appears that he went to Mecca for Hajj. Examination revealed numerous small, irregular red spots on the trunk and lower extremities. Lumbar puncture was done. Microbiology and biochemistry labs results revealed the following. Gram stain showed gram-negative cocci in pairs that are catalase and oxidase positive. It grows in thyre martin agar. Protein was markedly increased, glucose was low, and the differential count showed 3,200 WBCs per millimeter cubed, mainly neutrophils. So when you get a scenario like this, you try and highlight the key points. First symptoms, عندنا neck stiffness والheadache. مكة وحج is also an important clue. الred spots اللي هنا واضحة في الصورة, another very important clue. And next you go and see the lumbar puncture results. قلنا gram negative, cocci in pairs. طيب. Question number 1. What is the most likely diagnosis for this patient? صح إن شاء الله. كلكم قلتوا acute pyogenic meningitis. طيب. What is your justification for your answer in the previous question? أبغى justification in regards to the lumbar puncture result. وش خلاكم تقولوا إنها pyogenic meningitis مو viral ولا tuberculous ولا يلا تمام high neutrophils. Yes, it's very important to look at the differential اللي هو high neutrophils, but also it's important to look at the WBC count. It's in the thousands range. قلنا لما يكون بالآلاف يعني we're talking about bacteria. ولما يكون mainly neutrophils we're talking about bacterial infection. الred spots yes صح, وراح أسألكم عنها بعد شوية. طيب الجلوكوز وش فيه؟ is low. This suggests bacterial. تمام؟ Also, again, it's important to remember the morphology اللي هو gram-negative cocci pairs. الحين, what's the most likely causative agent? ليش قلتوا Neisseria? Why did you guys say Neisseria? Okay, petechiae, الage, صح. Gram-negative cocci, صح. Okay, you guys are all right. You see, this is why it's important to memorize the morphology, because the question may be like, what is the most likely causative agent? And you need to mention the name of the bacteria, especially in the sac. يحبون الحركة هذه مرة. طيب, mention 2 of the recommended antibiotics that can be used empirically in such a case. أعطوني 2 of the antibiotics. vancomycin, صح. الثاني إيش؟ Yes, ceftriaxone and vancomycin. Excellent. طيب, نجي للكيس الثاني. A 4-month-old boy was brought by his mother to the clinic because of fever. His mother mentioned that he's been vomiting in the last several weeks. After checking for papilledema, lumbar puncture was performed, and the results were the following. The cerebrospinal fluid was clear with normal glucose, normal chloride. Protein was slightly increased. WBCs were 700, mainly lymphocytes. Microbiology lab results didn't reveal any organism under the microscope after staining with gram stain and India ink. The doctor ordered the CT scan, which didn't reveal any intracranial mass or abscess. What is the most likely diagnosis? Okay, excellent. Viral meningitis. No, it can't be cryptococcal لأن سوى الإنديا ink stain with negative. Cryptococcus will appear on India ink. Another clue is the WBC count is in the 100 range. The main cell type is lymphocytes. CSF was clear. I don't know if I mentioned that point ولا لا, لكن في acute pyogenic meningitis pyogenic ال CSF بيكون كذا شوية turbid or looks like pus. أما في الفيرال لا, يكون clear نفس الطبيعي, ما يتغير شكله. Exactly, normal glucose, normal protein, almost normal protein. Excellent. It's viral meningitis. طيب, what is your justification for your answer? We already mentioned. قلنا ال WBC and this CSF analysis is normal. Okay. اللي بعدها. A 30-year-old male presented to the clinic complaining of fever that occurs with irregular intervals, accompanied by night sweats in the last several weeks. But the patient doesn't look very sick. After taking further history, it appeared that he is coming from the countryside and working as a shepherd. What is the most likely diagnosis? Excellent. Yes, chronic meningitis due to brucellosis. أولاً, the presentation is chronic, several weeks, ما جاب كم يوم. Intermittent fever والnight sweats هذه is a big clue. History and working in the countryside is also another big clue. Yeah, excellent. Okay, thank you everyone for listening. إن شاء الله أفدتكم لو شوية. I hope it was clear. I hope it was easy to grasp. I was honored to give this lecture and I hope you guys enjoyed it. If you guys have any questions, you can ask them now in chat, or you can email me or just DM me on Twitter. Yeah, just feel free to ask anything. Okay, thank you. Bye-bye.